But one question I'd really like us to address is much later on in the book, you cite Lacan asking the question, which we hear reverberating still, where have all the hysterics gone? So it's about 122. If you don't mind, I'll just give you a little bit of the fuller Lacan quote, because you've quoted him at length, I think, from his 1977 essay on hysteria. He says, "Where have they gone, the hysterics of yesteryear? Those wonderful women, the Anna O's or the Emmy von N's, they not only played a certain role, certainly a social role, but when Freud started to listen to them, it was they who allowed for the birth of psychoanalysis. By listening to them, Freud inaugurated an entirely new mode of human relations. What has replaced the hysterical symptoms of yesteryear? Has hysteria not been displaced to the social field?" That's the end of the Lacan quote. And then you offer the following comments. You say, "The hysterics discourse operates by constantly posing a question, and in so doing, she plays an important social role. She desires a new mode of human relations." And then you go on to say, "I'm tired of the definition of hysteria as a pathological relationship to masters and fathers, as a conflict around castration and the phallus, male and female power dynamics, and what have you. If conversion disorder speaks to a desire for another order of human relations in a way that hysteria no longer can, then I celebrate the disappearance of the term. Conversion picks up where hysteria left off and radicalizes the encounter with psychoanalysis." Tell us more.
I mean, it's interesting. You read all of these papers or at least I did, maybe not one, both from the American and from the French Lacanian side, that on the one hand extol the importance of hysteria in the history of psychoanalysis and the birth of psychoanalysis, what it taught Freud, where they led him that he otherwise couldn't have been led himself, the way in which they help reinvent the field. And then you find these papers that throw their hands up in the air, are frustrated, say that it's this impossible pathology. I think of Helene Deutsch, the as if personality. I think of everything that's said about borderlines these days. I think of the hysterics. They're all just looking for another master. They want to be the price of his castration. Don't let them get one over on you. You have to be strong as an analyst in the face of the hysteric. And I just got frustrated with this, sort of propping them up and tearing them down, which seems like a particular response to hysteria to begin with. And in that quote in particular, Lacan speaks to the fact that they were so important. They were the golden mouths of psychoanalysis. They really taught us something. Why don't they continue to teach us something? If it's displaced into the social sphere, is there still not something for us to learn? Does that mean that they're still not coming to our offices? And furthermore, if what they're after is a different form of social relation, that it's not just a conservative form that's looking to prop up mastery again, either on their own side or in somebody else, but in fact looking for something new, pushing us towards something new, then why aren't we continuing to listen to this? And why don't the papers that are addressing hysteria speak to that, to speak to what we're learning from them in the clinic itself? Mm-hmm. So that's kind of where I was starting from and bringing that up. And I do feel, and actually this has a lot to do with the question of the body and the question of the body in contemporary discourse, and the way also that I hear it as coming up in the clinical field is still around the ways in which feminine bodies in general, are treated in the world, in which they start to push the question, whether that's transgender discourse, whether that's the question that comes up when they want to address issues of wellness, right? And all of the sort of push towards Eastern philosophies and yoga and diet and toxins and all of this crazy discourse that we have these days on what it means to be well. Whether it's the attack on Western medicine, which I think is still very important. I still think we have a lot of patients that come saying Western medicine cannot address my problems. What can you, a psychoanalyst, have to say to me about my chronic fatigue or my Lyme's disease or my whatever illness that no one will diagnose or understand, which seems more classical, by the way. And then in general, the kinds of disruptions that we see all over the place politically right now, whether it's questions of issues of race, questions of privilege, this kind of asking a question of where can I be, within the world at this point in time. And wanting to say, why don't we learn something from this? Not to just accept it at face value, because we as analysts don't accept anything at face value, but to understand these questions in relationship to something singular in each person and what they tell us about what hysteria is asking about at this point in time.
So I have so many thoughts and questions here. Just, in some ways, the context of what you're speaking about in the book is also making implicit reference to Lacan's theorization of the four discourses, where we start to think about hysteria as a kind of discourse. And I'm reminded also in a recent interview with Tom Svolos speaking about Eric Laurent's notion of the new clinic of hysteria. And I'm reminded of colleagues in London putting together a book on, what is hysteria today? And these arguments that, if anything, hysteria transforms and takes on new and novel historical forms, so much so that what has happened to old hysteria and new hysteria, they seem to, at some surface level, seem to be almost discontinuous. So it seems that there's a kind of almost a crisis brewing in psychoanalysis about what to do with hysteria. And, different people mean different things by it. And in the Lacanian tradition, hysteria means something. It means one prospective part of neurotic structure. What is your stance? Do you still think that hysteria is a useful diagnostic structure? Or would you prefer to be thinking things in terms of a broader lexicon and rubric of conversion?
I see it as less discontinuous than, I think, at least of some of the people that you've mentioned. And I think that the people who see it as discontinuous, and I hear it's hard to generalize, right? Because there's so many variations, but let's be a little bit general for the purposes of the interview, are often having a difficult time listening to it. Maybe they're creating a new way of listening to the hysteria that they're presented with, and they need new categories for it. But at least in my appeal to conversion, I'm trying to keep a continuity. And insofar as I'm trying to keep a continuity, I'm saying that in any analysis, it's at the place of hysteria where there's something new that's being searched for, and that you as the analyst cannot have an answer to. You follow the patient there, and the analysis will go where it needs to go. And that's psychoanalysis 101. Mm-hmm. So I don't see that there should be a crisis.
Mm-hmm. Mm-hmm. I mean, maybe I overstate it. Maybe there's just a kind of flurry of contributions or questions of, I've seen things like people saying, well, a whole very, like, whether it's the whistleblowing phenomena, we can see this as indicative of hysteria in its new forms today. People also saying, well, even trance phenomena, now we see this as the new mode of hysteria. So maybe I'm not putting it very well, but it's just, I think there's a kind of an attempt to maintain and hang on to a key psychoanalytic notion and see it as a way of understanding a variety of phenomena within the world. I suppose that's legitimate enough. But could we make that move? Could we rather stay with a more elaborate, let's say, developed, exactly what you're offering in your book, understanding of conversion as a way of thinking these things? Or do we always end up going back to certain routine assumptions of what underlies hysteria?
It's a really good point. This was also my worry, was that the term hysteria is so overburdened, and that there's almost an imaginary problem, that it comes with imaginary about femininity and masculinity and castration and the phallus, that it carries all of this, that maybe perhaps becomes a problem for the analyst with respect to listening, and maybe the ambiguity and the almost formalism of conversions. I think a lot of the ways that I hear conversion is almost formalistic, tries to clear some of that out. And even the idea of the desire for change, which I write a lot about, that conversion in itself is a change that's also then desirous of change, insofar as it's the origin and aim of psychoanalysis, is also what you hear from these patients. I mean, sex change being a very obvious one, but also within the whistleblowing and the activism and the kind of that form, which is often being read through the hysterical lens, is someone desperately asking for something different to happen to them, for something new to happen. Yeah. And to take it very seriously, insofar as the lengths to which it needs to go, and that we psychoanalytically understand that these kinds of internal upheavals, these kinds of internal transformations are, something that really takes place at the limit of subjectivity, that's hard to bear, that's full of anxiety in order to get to that limit point. And that you as the analyst have to be very strong, in fact, to accompany your patient on the way. Because what you find is either that someone, can't handle it, can't handle the way that the patient pushes within their own life. It causes the analyst anxiety. Or the patient is having anxiety about it, which is causing acting out and, retreats and all kinds of substitute ways of managing it, versus we have to keep going. We have to keep going with one another.